You are walking through a familiar place when you notice it. Someone, a few steps ahead, is moving at what seems like an ordinary pace, yet the distance between you is slowly growing. You could walk faster, nothing is stopping you. But matching that pace now requires a deliberate push that it did not seem to require years ago. Perhaps the change is even subtler. You hesitate before crossing a busy road. You shorten your steps on uneven pavement. You slow down while turning, carrying a bag, or talking to someone beside you. None of these moments feels dramatic enough to count as a health problem. They are easily explained with one sentence. I am simply getting older. Age does influence walking, but age is not a speed control hidden somewhere inside the body. Your walking pace is the final decision produced by many systems, working together. Muscles generating force, joints allowing movement, lungs and circulation delivering oxygen, sensory organs tracking the ground, the brain predicting instability, and attention managing everything happening around you. Walking speed does not reveal your chronological age. It reveals how much functional reserve your body can organize into movement. That distinction matters because two people born in the same year can move at very different speeds, and the difference may have little to do with effort or personality. One body may have enough spare capacity to walk, talk, turn, and respond to the environment at the same time. Another may be using nearly all of its available capacity simply to keep each step stable, but that creates a deeper question. Why can such an ordinary movement contain information about so many parts of the body at once? Walking feels simple because you have practiced it for decades. Automatic does not mean simple. Before your foot leaves the ground, your nervous system has already estimated where your body weight is moving, how much force the opposite leg must produce, whether the surface is safe, and where the lifted foot should land. Muscles around the hip stabilize the pelvis. The knee controls the lowering and rising of the body. The ankle stores and releases energy. Vision scans the path ahead while the inner ear reports the movement of the head. Pressure sensors beneath the feet describe the ground. Receptors in muscles and joints report limb position. All of this information travels continuously. The brain compares what it expected to happen with what actually happened, then adjusts the next step. Walking is not a row of identical movements. It is a stream of predictions and corrections. Picture a control room receiving information from dozens of sensors. The operators are not trying to make the machine move as fast as possible. Their first job is to keep it from becoming unstable. Speed is allowed only when the control room believes the available force, balance, sensation, and reaction time can support it. This is why your preferred pace is usually not the fastest pace you can produce. It is the pace your nervous system currently considers efficient, manageable, and acceptably safe. When your physical reserve is large, ordinary walking uses only a small portion of it. Your leg muscles may be capable of producing far more force than each step requires. Your cardiovascular system may be able to deliver far more oxygen than the task demands. Your brain can manage a conversation, watch traffic, and change direction without coming close to its processing limit. When reserve becomes smaller, the same walk occupies a greater share of the system. The body responds by creating a margin of safety. Steps may become shorter, push-off from the ankle may become weaker, the time spent with both feet on the ground may increase, turns may become more deliberate. The person may appear simply to be walking slowly, but underneath that visible speed is a negotiation between movement and risk. And this is the first important reversal. Slower walking is not always a direct sign that the legs have become incapable. It may be a protective decision made by the nervous system. Suppose the muscles can still generate enough force to walk faster, but balance information has become less precise. The brain is now less certain about where the body is during each step. Speed magnifies the consequences of an error, so the nervous system selects a pace that gives it more time to detect and correct instability. The same thing can happen when pain is present. Pain does not merely hurt, it changes movement planning. The nervous system may reduce stride length, avoid loading one side, or limit the speed of weight transfer. These adaptations can be useful in the short term. They protect an irritated joint or tissue. But when they persist, they may gradually change strength, coordination, and confidence. Reduced capacity encourages caution. Caution reduces challenge. Reduced challenge can allow capacity to fall further. That cycle is easy to misunderstand because the visible behavior looks like the cause. A person walks slowly, so we assume slow walking made the person weak. Sometimes the direction is partly reversed. Weakness, discomfort, reduced sensation, lower endurance, or fear may have already changed the pace. The pace is the report, not necessarily the original problem. To understand what that report contains, start with the force required during a normal step. Walking does not demand the maximum strength of the legs, but it does require repeated moments of force delivered at the correct time. The hip muscles stabilize the body as weight shifts from one leg to the other. The thigh muscles control the knee. The calf muscles help propel the body forward. The amount of force matters, but timing matters almost as much. A muscle that can produce force slowly in a controlled test may still struggle to produce it quickly enough when a foot slips, or the body begins moving outside its stable base. That rapid ability is often described as muscle power, not simply how much force can be generated, but how quickly it can be generated. With age, maximum strength can decrease, but rapid force production often becomes especially important. Some of the larger, faster muscle fibers may shrink. Communication between the nervous system and muscle can change. Motor units, the groups of muscle fibers controlled by individual nerve cells, may be lost or reorganized. Surviving nerve cells can sometimes take responsibility for abandoned fibers, which preserves function, but the resulting system may be less precise and less capable of producing rapid bursts of force. The muscle has not forgotten how to contract. The available force, speed, and coordination have changed. This helps explain why someone may perform ordinary tasks successfully, yet feel less secure when the task must happen. Standing from a chair may still be possible, but catching balance after an unexpected shift feels different. Walking across a quiet room may feel normal, while crossing a road before the light changes exposes the smaller reserve. The threshold has changed. Muscle is only one part of the story. Every contraction depends on energy, and every step requires the cardiovascular system to support repeated work. The heart pumps blood, blood carries oxygen, and small vessels deliver that oxygen to active tissue inside muscle cells. Mitochondria use oxygen and fuel to produce much of the energy needed for sustained movement. At a comfortable pace, a well-conditioned system meets this demand without creating much sensation. Breathing remains easy. The legs do not feel heavy. The walk does not require conscious effort. If oxygen delivery, extraction, or energy production becomes less efficient, the body may still complete the task, but the cost rises. A pace that once occupied a small fraction of capacity now sits closer to the upper limit. The person naturally selects a slower speed because it allows energy demand to remain sustainable. This does not mean every slow walker has a heart, lung, or mitochondrial problem. It means walking pace reflects the combined cost of moving the body with the systems currently available. And the detail that matters is not only how much capacity exists, it is how much capacity remains unused during an ordinary task. Imagine two people walking at the same speed. For the first person, the task uses half of the available capacity. For the second, it uses almost all of it. Their pace looks identical, but their reserve is not. Ask them to climb a slope, carry groceries, speak while walking, or recover from an illness, and the difference may suddenly appear. This is one reason researchers became interested in gait speed as more than a mobility measurement. It required little more than a measured walkway and a timer, yet it seemed to contain information that isolated laboratory measurements sometimes missed. In a large pooled analysis, researchers combined information from 9 groups of community-dwelling older adults. Altogether, the data included more than 30,000 people aged 65 and older. Participants had been timed while walking at their usual pace, then followed over subsequent years. The question was not whether fast walking would make someone live longer. The researchers were asking whether usual walking speed reflected differences in health and function that were also related to survival. It did. Across the combined groups, faster usual walking speed was associated with better survival. The relationship remained visible across a wide range of speeds, and gait speed added useful information beyond age and sex alone. But the result needs to be interpreted carefully. The measurement did not prove that increasing someone's speed would automatically extend life. Walking speed can be influenced by disease, strength, pain, fitness, balance, cognition, medication, mood, environment, and many other factors. It acts more like an integrated signal than a single cause. Not a diagnosis, not a verdict, a signal. That is precisely what made the finding useful. A laboratory test might examine one organ or one variable. Walking requires many systems to cooperate in real time. When the pace changes, the cause may lie in one system, but it may also reflect several small changes accumulating across the body. This is where the story stops being only about your legs. Walking also depends on attention. In a quiet hallway, you can devote most of your processing capacity to movement. Daily life is rarely that controlled. You listen to someone, remember where you are going, watch for a car, judge the speed of another person, avoid an obstacle, and plan the next turn. The brain must divide resources between movement and everything else. Researchers often explore this by asking people to walk while performing a second task, such as counting backward, naming words, or responding to questions. Many people slow down when the cognitive task is added. That slowing is not necessarily abnormal. It reveals that walking and thinking are drawing from some of the same limited processing resources. The change can become more noticeable when balance is uncertain or when cognitive reserve is reduced. The nervous system protects the task it considers most urgent. For many people, that means sacrificing speed to preserve stability. This explains a familiar experience. You may walk smoothly when alone, then slow down when someone begins a complicated conversation, or your steps may become less confident in a crowded place, even though the floor itself is perfectly flat. The environment has increased the processing load. The second reveal, then, is that a change in walking pace may partly be a change in how the brain allocates attention. Walking is both movement and cognition. The brain must initiate steps, sequence muscle activity, predict consequences, suppress unsafe movements, update the body's position, and adapt to uncertainty. Regions involved in planning, attention, sensory integration, and executive control all contribute. This does not mean a slow pace proves cognitive impairment. Pain, low fitness, poor vision, joint limitations, and simple caution can produce the same visible outcome, but it explains why walking speed can sometimes change alongside cognitive function. The same brain that organizes thoughts is also helping organize movement. When reserve is high, these tasks coexist easily. When reserve is smaller, interference becomes visible. The sensory systems add another layer. Balance depends on information from vision, the inner ear, and receptors in muscles, joints, and skin. No single source is perfect, so the nervous system combines them. If one source becomes less reliable, the others must carry more of the load. Consider walking through a dark room. Vision contributes less, so the brain relies more heavily on sensation from the feet and joints, and on the balance organs of the inner ear. If sensation in the feet is reduced, darkness has a larger effect. The person slows down, widens the steps, or reaches for support. That slower pace is not irrational fear. It may be a sensible response to less precise information. Vision changes can have similar effects. Reduced contrast sensitivity can make a curb, shadow, or uneven surface harder to judge. Bifocal or progressive lenses can alter how the ground appears through different parts of the lens. Inner ear disorders may create dizziness or uncertainty during head movement. Numbness in the feet can weaken the map of the ground. In each case, the nervous system may buy additional correction time by reducing speed. The body is not merely producing movement, it is managing uncertainty. Joint mobility also shapes the pattern. If the ankle does not move freely, the body may shorten the step. If the hip does not extend comfortably behind the body, stride length may decrease. Arthritis can reduce loading on one side. Spinal stiffness can limit rotation between the trunk and pelvis. None of these changes must be severe to influence pace. Small limitations can accumulate. A slightly weaker push from the ankle, a slightly shorter stride from the hip, a little less confidence during single-leg support, and a modest rise in energy cost may combine into a clearly slower walk. Looking only for one dramatic cause can miss the way functional aging often works. It is frequently the sum of several manageable changes rather than the arrival of one catastrophic failure. Age affects this equation by changing thresholds and reserve. Muscle tissue may respond less strongly to small doses of protein or low-intensity loading, a phenomenon often described as anabolic resistance. That does not mean older muscle cannot grow or repair. It means the signal may need to be clearer: sufficient protein distributed through the day, progressive resistance, adequate recovery, and enough challenge to tell the tissue that its current capacity is still required. The system remains responsive. The threshold may be higher. Connective tissues can also become stiffer. Joint ranges may narrow when they are rarely used. Tendons may transmit force differently. Recovery from unfamiliar activity may take longer. Sleep can become more fragmented, reducing the quality of recovery. Medications may affect blood pressure, alertness, reaction time, or balance. Chronic conditions may alter sensation, oxygen delivery, movement confidence, or energy availability. None of these changes is explained simply by saying someone is older. Age changes the background conditions under which the systems operate. It does not dictate one inevitable pace. This is important because walking speed can change in both directions. Long-term studies have found that trajectories matter. Some people maintain a relatively stable pace for years. Others decline gradually. A smaller group declines more rapidly, and that faster change is associated with poorer outcomes. The pattern often matters more than one measurement. A single slow walk may reflect fatigue, illness, pain, a poor night of sleep, an unfamiliar environment, or cautious footwear. Even motivation can influence the result. Comparing your pace with someone else's can be misleading because height, leg length, body structure, health history, and walking context all differ. A repeated change within the same person is often more informative. You may notice that the usual route takes longer even on good days. You may begin avoiding slopes that once felt ordinary. Talking while walking may become unusually difficult. Turns may require several smaller steps. You may feel that your feet do not clear the ground as easily, or that one side is no longer contributing in the same way. These patterns do not identify the cause, but they provide useful information. The practical question is not, how fast should everyone walk? There is no single pace that separates healthy aging from unhealthy aging for everybody. The more useful question is, what limits this person's comfortable speed? And has that limitation changed? For one person, the limiting factor may be leg strength. Standing from a low chair, climbing stairs, or walking uphill may feel disproportionately difficult. For another, endurance may be the issue. The first few minutes feel normal, then breathing becomes harder, and the legs lose energy. Someone else may have enough strength and endurance, but slow dramatically on uneven ground, in dim light, or while turning, pointing toward balance or sensory demands. Pain creates its own pattern. A painful knee or hip may shorten one step and reduce the time spent on one leg. Foot pain may change. Push-off. Back pain may reduce trunk rotation. The body reorganizes movement around the painful area, often before the person consciously notices the new strategy. Attention-related limitations may appear mainly when the environment becomes complex. The person walks well in a quiet room, but becomes slower or less stable while talking, carrying something, looking for an address, or navigating a crowd. Different limitations can produce the same visible speed. This is why forcing yourself to walk faster is not always the correct response. If the pace is slow, because the body lacks challenge, gradually practicing faster and more purposeful, walking may be useful. But if the pace is slow because of dizziness, chest discomfort, severe shortness of breath, new weakness, significant pain, or instability, speed is not the first problem to solve. The signal needs interpretation. A sudden, unexplained change deserves particular attention. Gradual slowing over years is different from a noticeable change over days or weeks. New one-sided weakness, facial drooping, difficulty speaking, severe dizziness, fainting, chest pressure, or sudden loss of coordination requires urgent medical evaluation. A recent increase in falls, new numbness, or a rapid reduction in walking tolerance also warrants professional assessment. The goal is not to turn every slower step into a warning. It is to recognize when the pattern has changed enough to ask why. When the change is gradual and medically appropriate to train, walking itself may be only one part of the solution. Walking practices endurance and coordination, but it may not provide enough stimulus to rebuild every limiting system. Strength work can increase force capacity. Exercises performed safely at a faster intention can train power. Balance practice can improve the nervous system's ability to manage instability. Mobility work can restore usable joint range. Aerobic activity can reduce the relative energy cost of ordinary walking. The most effective approach depends on what is limiting the pace, and improvement does not always appear first as a dramatic increase in speed. It may appear as less effort at the same pace, a smoother turn, greater confidence on uneven ground, the ability to talk without slowing as much, a longer distance before fatigue, easier recovery after a hill. These changes represent additional reserve. Walking speed is therefore valuable partly because it makes reserve visible, but the number is not the entire story. Researchers have estimated that changes of only a few hundredths of a meter per second can sometimes be meaningful in older populations, while larger changes are more clearly noticeable. Even so, those values come from group-level research in clinical settings. They should not be treated as universal personal targets. The direction, consistency, and context matter. You do not need to race through daily life to prove that you are aging well. A person may choose a relaxed pace and still possess considerable reserve. The revealing question is, what happens when the situation asks for more? Can the body increase speed safely? Can it manage a turn, an obstacle, or a conversation without losing control? Can it recover after the effort? Reserve is the distance between what an ordinary task requires and what your systems can still provide. When that distance is large, movement feels easy. When it narrows, the nervous system becomes more selective. It reduces speed, simplifies the task, and avoids unnecessary risk. That response should not be treated as laziness. It is the body adapting to the capacity currently available. But adaptation can become a trap when caution permanently removes the signals required to maintain capacity. If every demanding movement is avoided, the muscles receive less reason to preserve force. Balance receives fewer opportunities to practice correction. The cardiovascular system is challenged less often. Confidence shrinks because the movements feel increasingly unfamiliar. The body becomes efficient at the life it is repeatedly asked to perform. That principle works in both directions. Appropriate challenge tells the nervous system that speed, strength, coordination, and recovery are still required. It does not erase every effect of age or disease. It does not make all bodies identical. But it can expand the reserve available for ordinary life. This is information, not a promise. Medical conditions, disability, pain, medication effects, and previous injuries can place real limits on movement. Some people need individualized guidance from a physician, physical therapist, or rehabilitation professional before changing how they train or walk. The point is not that everyone should move faster. The point is that your comfortable pace emerges from many systems, and many of those systems remain adaptable. Return to that familiar walk. The person ahead is still moving away from you. Perhaps you decide to increase your pace for a few steps. What happens next may tell you more than the speed itself. Do your steps lengthen smoothly, or does the movement become unstable? Does breathing rise slightly, or does it suddenly become uncomfortable? Can you maintain the pace while watching the environment, or does all your attention move to your feet? Do you feel limited by strength, pain, balance, confidence, or energy? Your pace is not simply a number attached to your age. It is the visible result of your body deciding how much force, oxygen, attention, sensation, and confidence it can safely organize at once. A slower step is not automatically decline. A faster step is not automatically health. The real signal is reserve. Your walking speed does not tell you how old you are. It shows how much of your body can still work together when you move.